Okay, we are here now with Ikara Cecile, Assistant Professor of Public Health at the University of Indianapolis. And yeah, a more serious note this morning on Indy Style, because this is a big topic. A lot of people concerned about the coronavirus. So let's separate the facts from a lot of the myths out there that we're hearing. So first of all, what is the coronavirus?
So it's a virus from a known family of viruses. It's a
Okay.
novel virus in itself, but we know more about this family. MERS and SARS come from the same family.
What do we need to do or not do?
Right, both are really good questions to ask. It's a respiratory virus. It's spread through coughing, touching your face, sneezing, things like that.
Okay.
We know that there are really good common sense things to do that we can stop the spread of
Like the
coronavirus.
wash your hands, right?
Washing your hands. It's also good to stop the spread of all kinds of infectious diseases, seasonal flu, norovirus, anything else that's communicable. Those
Yeah.
good common sense practices will help.
I think that's what I've seen there, especially on social media. A lot of people say, no, you're so worried about this. Turns out it's a good idea to wash your hands all the time, because there
always a
are
good
other
idea.
things that you can get as well. I want to talk about this because so much of what I've seen is people wearing masks. They're talking about the need. Do these do anything? Are they necessary?
So I want to just distinguish between the two. So this
Okay.
is a medical mask, and this might be something you see in your doctor's office sitting on the desk where you sign in.
Yeah.
And if your provider suggests that you wear this, then of course that would be a good idea. If you aren't symptomatic, if you aren't in a high-risk group, these aren't really necessary, and it's important to know that we need to leave these to the medical providers who need to access them.
Okay.
The difference with the N95 respirator, this is going to do a better job at protecting us from the germs and all kinds of environmental exposures. But again, if you are not in a high-risk population or you're not traveling somewhere, you don't need this, right? So leave these to the healthcare providers
Okay.
so they can access them.
Well, let's go on that. What if you are traveling? Does it depend where you're going, how far you're going?
Right, so that's a great question. Spring break is coming up,
Yeah.
right? So a couple of places of sources you can look. So the CDC has a coronavirus travel webpage. I would really
Okay.
suggest people check there. It's an unfolding situation. Information could be different at the end of the week or next week. So we know that there are 4 countries that are kind of at the highest level, and that would
Yeah.
be China, Iran, South Korea, and Italy. If you have those kind of international travel plans, I would really be talking with healthcare providers, checking that website. If you're traveling within the country, if you have spring break plans to go to the beach,
Yeah.
just do the common sense things of wash your hands, keep your hands off your face,
Yeah.
all those things we know.
What else do we need to know to protect ourselves? Is there anything else that we can do?
Right, so washing your hands, I have a couple other things here. So soap and water for 20 seconds is really what you're gonna go for.
Okay.
It mechanically gets the germs off your hands. This is your best option. So a bar of soap. This is another fun option. It's a stick, so kids kind of like it because it has color to it, right?
Yes.
I have that
Make
from
it fun.
home.
Make it fun for
right?
them, yeah.
The kids. And then if you don't have access to soap or water, hand sanitizer with at least 60% alcohol
Okay.
is your best option. But this really should be plan B to just standard soap and water, washing your
I think
hands.
the big question, how worried should we really be about this? I mean, who's more susceptible? Is it perhaps little ones, elderly, those with a compromised immune system already?
Right, and that's a question that a lot of people want to have answered. So
Yeah.
we know it's a respiratory disease, and certain populations with underlying conditions, respiratory conditions, diabetes and heart disease, those underlying conditions do put them at a higher risk. So they might want to wash their hands a few more times, things like that.
Okay.
Other than that, we're not seeing that young children have a significantly greater risk to coronavirus.
Okay, and obviously this is going to be unfolding as the days, the weeks, the months pass. Where can we go for more information if we still perhaps have a few questions?
Sure. So I would definitely recommend going to the CDC's homepage on this. If you're traveling, go to their coronavirus travel webpage. If you're someone that it's just a good time to get prepared or
Yeah.
check what supplies you have at home, I would go to ready.gov, and they have a page specifically for coronavirus. And that'll include things like just extra food, refilling the Tylenol or something
Okay.
you have at home,
Well,
that
things
kind
like
of
that.
thing.
Thank you so much.
Yeah,
Appreciate
thank
your
you.
time and, of course, the education as well. We'll put those links on our website, indystyle.tv. Tracy, I think one good thing that can come out of this is just better health practices in general, perhaps. Just, better use of washing your hands, using that hand sanitizer, and just paying more attention, I think, is always a good thing.
Regardless.
Exactly.
Regardless.
That's what I'm saying.
You know,
Regardless.
your industry.
Of course.
Absolutely.
Constantly.
Constantly. Yeah, he was just nodding his head in complete agreement over there.